Welcome to Cybers, the electronic assistant. Now we are in the registry with patients, to whom all the data of all services are linked. Let's create a new patient. The system takes into account gender and date of birth in all services, so I recommend entering them correctly. Your visits have appeared on the right and other graphs of the patient's basic data have become available. Let's move on to a new visit. And we immediately see the main field of the program, the selection of treatment. Its format depends on the selected section of medicine. The available sections are listed here. There are actually more of them, and you can configure them in more detail. The main navigation buttons are presented at the top, the registry, the visit block, by clicking on which you can open detailed information about the patient and the visit. Further links to the most popular services, as well as links to sections of the patient's medical record, to test forms, to instrumental research protocols and printing. All this is saved automatically during the current import visit. Working with the program goes through search input, which combines database search, as well as entering various commands for symptoms. You can find hundreds of thousands of detailed descriptions of drugs, diseases, tests, medical services, and so on. There are filters on the left to narrow down the search results. For example, I want to know what sulfu is. Clicking on the name opens a detailed description. For a homeopathic medicine, possible authors in different languages are listed here, such as Morrison, Barrique, Fountain. Various commands can be entered here. For example, open hemoglobin. The analysis form opened and the value we needed flashed. This allows you to find what you need in a huge database of cyber resources. Many of the Cybers commands are listed in the Here menu. All complaints and analyses of the patient are entered in the same line. For example, a patient has a headache. Enter either the Enter button or the Enter key. If this is an analysis, then the system immediately suggests entering a digit in order to decrypt it later. Symptoms can be entered one at a time or several at once separated by commas. Kiberis understands speech well and is able to decode most of the analyses, so it is very convenient to enter data by voice on a mobile device. If you are at a loss what else you can ask the patient, then you can look at the tips of the Cybers. Just answer these questions with yes or no. For example, Cybers adjusts to you, so the tips usually match your approach to treatment. We have the results of the selection in front of us. Their type depends on the branch of medicine. In homeopathy, this is a single table. The analyses were immediately deciphered, taking into account gender and age, and the conclusions were signed to it. Links to their description are subscribed to the recognized data. If you click on the text of the symptom, you can change it. On peasants, the symptom is erased. The figure following the cross shows how many drugs can treat this complaint. On allows you to turn symptoms on or off from the search, and this check mark allows you to combine symptoms. In this column, the importance and severity relative to other data is selected. By clicking on the symptom field, it can be swapped with the symptom in one section or moved to another section. This panel provides quick access to the comparison and prescription of drugs, so as not to enter their name in a quick search. In this section, you can note the preliminary effect of drugs using the Folium method, ART, kinesiology, and similar. After the symptoms, there are selected medications. At the moment, where the percentage reflects the average effectiveness of the drug in the treatment of all symptoms in one course. In this version of the calculation, preference is given to practical data rather than books. The cells indicate either the percentages of the effectiveness of the treatment of this complaint and the number of cases, or just books, if there are few practical cases of use. Suppose we have introduced a very rare symptom, the headache of the Bay of Virgins. Kiberis could not find this phrase anywhere completely and found it only partially. Therefore, the line is highlighted in blue. Such symptoms have little effect on the selection results. When clicked, detailed information on statistics and quotes from authors are available. To go to the source text, click on the author's name, where the desired piece of text will blink. What should be treated first? Each doctor chooses for himself what is more important to him. Let's imagine that it is important for us to cure a headache in the first place. Click on the number of drugs next to it. A window has appeared where they are ordered by effectiveness or impact for this particular complaint. Statistics are constantly updated, but at the time of filming, this drug has the highest average effectiveness of headache treatment in one course. When you click on Read, detailed statistics and quotes from books appear, as well as in the selection. Clicking on the name of the drug opens a detailed description with highlighted orange sentences in which the patient's complaints are found. Please note that the last viewed drug will be in the first place in the list of drugs. You can cancel it with this cross. Now let's look at the results. Our drug has a high percentage of headache treatment, but the effect is lower for others. Or there is practically no data, only books. Let's open all the drugs again. Pay attention to this drug. He has a check mark on the left, so he knows the modalities that can be revealed or viewed by the word count. In our case, there is also a temperature, during which the effectiveness of headache treatment increases. These are deep relationships or modalities that can radically change the effectiveness of drugs in certain clinical patterns. Roughly speaking, this drug treats headaches only with intoxication syndrome. Or, for example, we will find another drug through a local search. The average effectiveness of the drug is small, but in the presence of these symptoms, the effectiveness increases significantly, and in the presence of other symptoms, it may decrease. All the modalities are taken into account automatically in the selection results. The second parameter is the effect or importance of the symptom, that is, how its presence affects the effectiveness of treatment of other symptoms. For example, let's add a bribe. It is unlikely that anyone will treat it, so instead of effectiveness, the effect on other symptoms, positive or negative, is shown. For example, some drugs work better or worse in single patients. The effect of less than 10% can be considered insignificant, so it is gray. Accordingly, the drugs of this symptom are varied in effect. If you want to cure chills, you can sort them by effect. All these studies can be viewed in the book Kiberis, which is one of the authors of many drugs. They are grouped into a kind of repertoire of one drug, the data in which are sorted by effect. But you can also sort them alphabetically. Now the screen shows the results of the selection of treatment according to Kiberis statistics. Unfortunately, it is not available in all sections of medicine, not for all diseases. You can calculate the results in points. In this case, the emphasis is on the book. It is possible to find suitable complex preparations corresponding to the excluded authors. In this case, the fewer components there are in the complex preparation, and the better each of them works, the higher the compliance indicator will be. This one. An interactive repertory has been created for classical homeopaths. You will not find symptoms from a century ago here, but there is data on diseases, analyses, and other relevant information. All that is regularly administered by thousands of doctors, and that has been tested by practice. Initially, the headings are sorted by occurrence in practice, but they can also be sorted alphabetically. In addition to the usual disclosure of categories, there is a local search. We'll find something. Unlike regular repertoires, symptoms are located in all the categories to which they potentially relate, so you do not need to memorize everything by heart. Each category shows the number of drugs that belong to it. Clicking opens a familiar description of the symptom. On the left are the most effective drugs. On the right are the categories of the repertoire. Here you can see the clarifying details and the modality. Unfortunately, users have different authors included in the search, and the repertoire is based on certain books and statistics. Therefore, the number of drugs in the categories may differ from the drugs found by the authors selected by you at the moment here. By clicking the Customize button, the authors for the search are configured in more detail, which is relevant, for example, for homeopathy. You can choose Bach flowers separately, or disable some of the authors for monopreparations, select specific manufacturers of complexes, individual Kiberis statistics stand out, which unites all sections of medicine. It is possible to select treatments from the point of view of individual authors. For example, there are cases on the widget. Or you can change the section of medicine, for example, to Chinese medicine, which is used for treatment mainly with complex remedies. Diagnosis is available as a percentage of relative probability. For more information, you can use the interactive appos by clicking on the little man. Here you can both look at the organs themselves, or simply click on the problem area, and Kiberis will show all the organs in it, and on the right the most frequent symptoms, as well as probable diseases, are displayed, taking into account the complaints you have already entered. And the most important for this field of research, all this is formed on the basis of ticked organs that can be customized. Let's add a couple of complaints and close the window on the cross. You can compare medications or diseases. Let's compare a couple of drugs through a quick search. In the window that opens, we see their most important distinguishing symptoms, sorted by degree of difference. Complaints already entered in the session are also taken into account. If there are more than 2 drugs, then they begin to be compared with the main drug. You can check the drugs for interactions and contraindications, which is especially important for standard therapy or when patients come from another doctor. Let's add some medicines from the quick search. The general conclusion of the system is indicated above, followed by a grid of drug interactions and their indications and contraindications, which can be read. Abbreviated sentences are displayed under the table, in which interactions are found, and more detailed information is indicated on the buttons with a map of the interaction of components and basic text of drugs. If you need to replace some kind of tool, then look at its analogues. This table contains indirect analogues that are similar in effect to the base drug. The higher the degree of similarity, the better the medicine can replace the one you specified. In reality, analogues can be called with a similarity above 50%. If the active ingredients of the drug are known, then full analogues with the same composition will be selected. You can add drugs that are already in use and known diagnoses that need to be taken into account when selecting analogues so that relevant analogues are selected that are as safe and effective as possible in the current situation. You can share the current set of comparisons, interaction checks, or an analog here. When we have decided on the choice of treatment and diagnosis, we will prescribe them using the button under the drug or through the Cybers chat. As we can see, everything is added to the assignment table, and then you can select the concentration, the delivery mode, and so on. It is very important to prescribe therapy and diagnosis because after a couple of months you will not remember what you prescribed. Audio products are an experimental technology of recent years. We removed the signal from the granules of the preparations using the technology of hypothetical selectors. With the help of artificial intelligence, the active part was isolated from it, cleaned, and amplified the received signal. Then we converted the signal into a sound wave and superimposed it on the carrier noise, which you will hear. When tested using instrumental methods of folio and kinesiological tests, the effects of the received sound preparations coincide with the granules in which they were recorded. So our technology is repeatable, so it has already been independently tested by doctors from around the world. All this has led to the creation of a database of sound preparations that can be used instead of classic granules. Moreover, their effect is often stronger due to technological amplification, and sound forms can be given out with varnishes. To test, just press the button with the desired potency. But it is much more convenient to prescribe the selected drugs. Choose their potency. The presence of a sound form is marked with an icon and a dose of sound. The default playback menu appeared for 1 minute. You can either edit the total playback time or enter your own dose time in seconds. You can add several drugs to the recipe. In this case, they will be issued simultaneously. However, it is possible separately. There is also a special option here. When enabled, all drugs will be prescribed as sound by default. The resulting recipe can be shared with the patient. Just send him this link. If you have a pro account, then the prescribed sound medications will be free for the patient. Let's look at the medical card, which is filled out by itself during the visit. You can also access the patient's basic data by clicking on his name. General information about the patient is located here. She herself is transferred from visit to visit. This section is responsible for transferring the patient to other doctors. To share the rights to a patient, find a doctor in the database here. The volume varies from anonymous viewing to full transmission. In addition to the basic data, the medical card contains many different forms. Links to them are located on the top panel. General examination and survey forms, including patient contracts, test forms, instrumental studies, and several medical calculators. There are a lot of forms, and in order not to get confused in them, you can search for the necessary appointments with a quick search. For example, open a liver ultrasound. The forms are related to the selection, like all services, so the complaints entered in the selection were automatically included in the form. For example, the values of the blood test were filled in themselves, and some others. And the unrecognized data was placed in the complaints field. If you mark something in the form, this data will automatically be transferred to the selection of treatment. For example, let's add a basic diagnosis based on a hint. So you can start the visit by filling out the medical card and look at the result. For example, there is a homeopathic survey form specifically for homeopaths, which can be shared with the patient. When the patient clicks on it and fills in his data, he will immediately be asked to fill out our form. And you will automatically get access to his visit. However, if you are missing something or are not satisfied with something, you can always create your own form in the form editor mode, although it will no longer be filled in by itself. After the visit, you can print it out. By default, only forms with at least one value are printed. You can also select several additional options. For example, you can automatically fill in all the normal values or do it in separate forms, and also print all the values, including empty ones. You can even automatically convert the entered diseases into MKV codes, and then even a couple of complaints can be turned into a fully formed medical record. You can turn off some of the forms or their sections. You can print all the forms at the same time, or select a specific form, for example, a general blood cut, and show all its fields. Follow these links to the specific forms for editing them. The visit is over. The patient returned after a while. We will start a new visit from the registry or from the patient's data. As we can see, there are previous appointments that can be transferred to the current visit by simply clicking on the icon. And all the data is shown below. Now, when interviewing the patient, we can note how the complaint has changed since the previous visit. It has disappeared, improved, has not changed or worsened, or you don't know how it has changed, but you want to move it to a new visit. For example, like this, it goes without saying that the analysis for dynamics needs to introduce a new value. You can read more about how to mark dynamics correctly here. Thus, it is possible to quickly assess the effectiveness of the prescribed treatment at the same time demonstrating it to patients. Then we will collapse the table to the arrow in the center or to the past button, which can be used to bring them back. If there are several sessions, they will be listed in this table, and all previously unmarked complaints or those marked in this session will be shown. Thus, if you do not know how the symptom has changed, then just leave it as it is, mark it next time. Using the speaker button, you can see a generalized graph of the patient's treatment over a long period. To reduce the data, you can select a specific period, disable complaints that have already passed, or find the right complaint through a local search on the page to view its dynamics separately. A chat is available in the program. You can find your colleague by name or by ID. Also, each object has its own group. For example, You can discuss the current patient with a consultation, or create your own interest group and invite people to join it. The program has various settings. You can access them through the menu by clicking on your name. It contains information about your cyber account and active orders. We recommend using the program with an active subscription. This is more convenient and improves the quality of the selection, as well as gives access to sound preparations. Next comes your personal data. First, the data in the cybers, and then the questionnaires of the doctor in the clinic. The following are the program settings. For example, you can disable autofill of forms, auto-decryption, instructions for all services, and so on. Then you will need to configure the search sources. Here are the trusted doctors and clinics with whom you have linked your account and who have access to your patients, which is especially convenient for work colleagues. And here are the controlled objects: clinics, pharmacies, doctors who have entrusted their patients to you, and so on. Editing is exactly the same as when delegating rights to a patient. You can also contact technical support via live chat. Thanks for attention.